everyone. Welcome to our July session, our July webinar at the Global Activist Network. I'm Lamona Chanda. I'm one of the co-founders of the Global Activist Network. And we're going to discuss a very interesting topic, a very different topic that we rarely discuss in the realm of the Sustainable Development Goals. And for that, we have invited someone very exciting, a very promising change maker. So today, our topic is advancing the Sustainable Development Goals through evidence-based health research, innovation, and youth leadership. And for that, we have invited Akinpelu Oluwase. Welcome to our platform, Oluwase. We're really excited and privileged to have you here today.
Yeah, thank you so much. I'm so glad to be here too. Yeah.
And so just before we, start with our questions that we have for you, I'm just going to read out a little bit of your background so that our audience knows all of the great achievements that you have reached so far. So Oluwase is a biomedical researcher with expertise in molecular biology, genomics, and computational vaccine design. He has authored more than 8 peer-reviewed publications spanning vaccinology, bioinformatics, and translational biomedical research. His scholarly work has been competitive at international levels, earning grant-supported acceptances and sponsorships at multiple scientific conferences. He currently serves as a teaching assistant in the Division of Vaccine Design and Development, where he supports research, training, and capacity building. His research interests include immunoinformatics, data-driven vaccine development, and the application of artificial intelligence in healthcare and biomedical research. So, as you can see, this is a very dynamic and very topical, very upcoming field to be in. And so I'm pretty confident that we're going to have a very exciting conversation today. So without any further delay, I'm going to start with our questions. Why don't we start by finding out a little bit about yourself, Oluwase, and sort of what inspired you to explore this area of work. It's so niche. It's so progressive. So what was your inspiration for all that?
Yeah, thank you very much. Thank you for having me. My name is Oluwase Samuel Akinpelu. I'm from the underserved region of Nigeria, the southwest Nigeria. So I'm an early career biomedical researcher and a microbiologist. I'm currently serving as a teaching assistant at the Elizabeth Institute in Nigeria. My research interests include vaccine design, bioinformatics, pathogens, genomics, antimicrobial resistance, artificial intelligence, and biomedical research, One Health, and infectious disease pandemic preparedness. So I've been involved in mentoring students, building research capacity in emerging African scientists. And my interest in the field was inspired by the unequal burden of infectious diseases in African communities. So many preventables and treatable diseases continue to affect people because of inadequate research infrastructure and limited access to diagnostic technology. We are in Africa, we have a very weak surveillance system and insufficient locally developed solutions. So one of those things that eventually led to me doing all these things was what happened in the year 2019, when COVID-19 came into our so long. And eventually, an mRNA vaccine came to our rescue, the global rescue at all. So I felt like if we decide not to face our problem, we can't always be dependent on people to solve our problem. So that is that. So, these experiences motivated me to pursue research that contributes only not to scientific publications, but also to stronger health system, improve local capacity, community engagement, and African-led health innovations. Over the night, I just flew back to my hometown I was in a conference where we talk about human papilloma virus, and I'm from a region whereby people have been suffering from, young girls have been suffering from cervical cancer over the years. So I just have to go to the conference, have my words there, and learn some things that will be of help to my home community too. Thank you very much.
It's very interesting that you mentioned human papillomavirus because at I spent a good amount of time in Canada, and I'm aware that countries like Canada, or like countries that are considered quite developed, they have vaccines that they can administer quite early on age, so that girls at a later stage can avoid or
Yeah, yeah.
prevent having uterine cancer, or all that stuff. So
Yeah.
we all know that there was vaccine inequality. Not all the
Mm-hmm.
countries received vaccines the way they should have received, which is why what you're doing is so precious. We need more people like you. So, what inspired you to pursue evidence based health research, and how do you sort of connect it with, sustainable development goals?
I actually pursued evidence-based health research because effective health decisions must be guided by reliable data rather than assumptions, opinion, imported solutions that may not really reflect our local realities. It's not as if we don't have a vaccine here in Africa for human papilloma virus, but when there was a rollout 2 years ago, we have a very low uptake. People don't really have so much knowledge about, oh, if you take this vaccine, this is what this thing will cause, not having the true fact about this thing. So evidence-based research helps us to understand the causes and distribution of health problems, identify the effective interventions, measure outcome, and allocate limited resources appropriately, determining whether programs are equitable and sustainable. Research, when it comes to the aspects, contribute directly to this SDG 3, which focuses on good health and well-being, and also contributes to other goals. It supports SDG 4, which it talks about strengthening education and scientific trainings. SDG 5, identifying and addressing gender-related health issues. Just we are talking about human papilloma virus now. A lot of people don't eventually know that most of these young girls can eventually contact human papilloma virus from guys, even though guys cannot visibly show the symptoms.
Yes. Um,
So it also support the SDG 9. We talked about research, technology and innovation, 10, 13, 17, and so on. So evidence-based research is therefore not a simply academic activity, just as I've mentioned. It's an important tool for policy development, program implementation, accountability, and sustainable development across the globe.
so, you mentioned, you work in an area which is so probably this is like the future of disease prevention in many different ways. So, and then, we exist in an era of rapid technological advancement. How can, from your experience,
Yeah,
how
yeah.
can innovation help address persistent health challenges, particularly in underserved communities?
Yeah, thank you very much. The first thing I will say is artificial intelligence. I was in Ghana for West Africa wastewater surveillance in the month of April. I won Bill Gates travel grant to go and make my presentation there. So we are all across the globe, and I see how the Western world have deployed artificial intelligence into their surveillance. We in Africa, we are still talking about data that we can just gather, ask people about it. They have a system to study their sewage system to know, okay, this particular wastewater have the tendency of causing a particular pandemic, or maybe a pathogen is present. Number one is artificial intelligence. Artificial intelligence supports disease predictions, diagnostics interpretation, vaccine and drug discovery, health communication, and public health planning. That is number one when it comes to this aspect. And the next one is genomics. So genomics can help us to identify emerging pathogens, monitors disease transmission, detect antimicrobial resistance, and guide vaccine development. So what the technology behind mRNA vaccine development, in which I'm an expert in, I've been here in this field for more than 4 years now. I've contributed to some vaccines that we soon undergo preclinical trials and stuff like that. I find out that with genomics, it will help us actually to tailor what we want to do towards the pathogen, not just doing try and error over time. As you see, the former knowledge we have about vaccine is that you have to take longer years, but mRNA vaccine within 6 months we have a vaccine candidate. So that is one of the aspects of genomics coming into it. And the next one is portable diagnostic devices. We now have point of care diagnostic kit whereby somebody can just test himself set at home without going into the hospital. So it brings us closer to the rural community and reduce dependencies on central laboratories. You know, in Africa we have majorly rural communities.
Yes.
So whereby they cannot have access to some common things that would be in a city. They might not have a lab to test themselves. What with evidence-based research, AI and stuff's coming in, they can have a portable diagnostic device that they can test on themselves without so much knowledge of having all these terminology, scientific terms. So that is that. Another one that I can still mention is mobile health platform. We now have apps you can log into now. You can meet a medical doctor online. You can tell the doctor your problem and will tell you what you will do. Wastewater surveillance, just as I've mentioned. However, innovation should not only be judged on how technology is advancing. A successful innovation must be affordable. This is where SDG come in. Accessible, ethical, inclusive, culturally appropriate, scalable, and locally maintainable. So this is one of the things that will make this thing work. So innovation should begin with the need of the community rather than the technology. So we have something called implementation science now, which we have been dealing with. I was in the training, the conference for 5 days, talking about implementation science. We can't just go into community and tell them this is our solution. The community have the ability of telling us how we will be able to use our solution in an appropriate way that work for them. So that is that. Innovation should begin with the need of the community rather with the technologies. You know, if you design the mRNA vaccine now and eventually you need a cold region to store it, in a rural area where they don't have a cold region where they can store the vaccine, it will work there. So when local people are involved in designing and implementing solution, the innovation become more relevant and sustainable.
Yes.
Yeah, thank you.
And so, you know, we have change makers watching these discussions, and not everyone come from a health background. Just for their understanding, can you share a research project or a health innovation project that has had a measurable impact or improving health outcomes, advancing the sustainable development goals? In short, can you sort of share like a successful project in your experience that you have come across?
Oh, thank you very much. I will make an example of my work, a collaborative research that's focused on bioinformatics designing of an mRNA vaccine against molecular virus using immunopharmatic approach. Molecular virus is indigenous to us in West Africa, and unfortunately is actually from my state. Okay. The virus was isolated in my state in the year 1970. So
it hasn't been that long. Yes.
Yeah, so it hasn't been that long. So unfortunately, 2-3 years ago, WHO listed it among the disease pathogens. Disease pathogens are diseases that have the potential of causing another pandemic. So seeing the pathogens that is from my state on the list, I was shocked. That means we have to face our problem. So I was involved in this project of designing a candidate vaccine that we eventually tackle this pathogen that is from my state. And this project actually produced a measurable scientific and build capacity building outcome. So it was actually published in a journal, BMC Immunology, in the year 2024. And I've presented the same work in Keystone Symposium of Vaccinology at the United States, the ECOWAS Lassa FIFA Conference in Ivory Coast, West African year, and United States Frontier of Science, Engineering, and Medical Symposium that's held in Senegal earlier this year. So it thought to create created opportunity for students and early career researchers to participate in research, scientific writings, and conference presentation. One shocking thing that I do tell people is that I started traveling out for conferences when I was in my final year in the university, which is very rare when it comes to African community. You barely see students having privilege to go out there to talk about what we can do, to let them know our challenge and how the Western world can help us and stuff like that. So I actually became a known for that thing. Oh, is the student is still traveling out? Is the student is still doing this and that? Because I decided to face our problems. So that is that. So this project eventually contributes to the project I was involved with, SDG 3, 4, 9, 17. And most importantly, it is communicating our current impact honestly. So that is a good part of it. So the present stage of this vaccine, the vaccine will soon undergo a clinical trial very soon. Is that we actually tailor this towards all the whole world genome. So we are not just doing a vaccine that will only work in a part and will not work in a part. We have our people involved.
That's excellent. And I think that's very important as well. I have a follow-up question about that, but I'll come on to that question later on. So how do you ensure, and some of your response might overlap with the question that I'm asking you now, how do you ensure that research findings are translated into practical policies, programs, and solutions that actually benefit the communities on the ground?
Thank you very much. Let me start with research translation should be planned from the beginning of the project rather than after the research has been completed. So I believe the process should involve 4 major stages. And the first one is exploration. Researchers must understand the problem of the engaging communities, the health workers, the policymakers, the civil society organization, and other stakeholders. And the next one is preparation. This includes obtaining ethical approval to know how the government will see this, developing concept procedure, and adapting the intervention to the local context. So this will actually help us to establish a baseline indicator and defining the implementation pattern. And the next one is implementation. So the intervention should be tailored. Users should be trained, outcomes should be monitored, and relatively continuous. So the last one is the sustainment. So the intervention should be integrated into a existing system. So one thing I find out about African health system is that you can't come to us with a new thing and the thing will just go on like that. You have to see what we have been doing before and try to integrate instead of introducing new thing. So that is one of the way you can sustain it when it comes to Africa. So the intervention should be integrated into the existing system, supported by local ownership and links to the realistic long-term financing. So this is what I just mentioned now. We call it EPIS framework in implementation science. So this eventually helps, and the research finding must be communicated in a format suitable for different audiences. Well, if you come to my part of the country now, if you come here without a translator and you go to our rural areas, you will find out that no matter the solution you are bringing to them, they will not accept you. Then the first thing is that they must accept you. So if you want to communicate your findings, you must find somebody to tell them what you mean in their language. They don't understand all the scientific terms. So I believe a good science is a science that a market man can pick up your good and use it. Not a science whereby the words are too ambiguous that they cannot relate with it. So that is that. So the aim should not just be able to produce evidence, but to produce evidence that can be understood, adopted, and used by the community.
Absolutely. So I'm just going to ask you the follow-up question that I thought of. You mentioned involving local people, you mentioned local ownership, and this is directly involved with that. A lot of the times a disease impacts differently among different ethnic backgrounds. However, funding exists in the developed countries. And
Mm-hmm.
Africa might have a different problem. South Asia might have a different problem in terms of diseases that sort of emerge in those regions because of the climate, the geographical location. It can be anything. So, my first question is, do you think there is adequate funding to pursue good research? And the second thing is, how can we best utilize the local knowledge that is, at least I feel, is essential in sort of promoting good evidence-based research?
Yeah, thank you very much. Let's not deny the fact that when it comes to the funding seems not to be so enough. That is the truth. That is the truth. I will not lie to mention some African countries. The money they put in their budget for health related stuff is too small. Yeah, there is one fact I will tell you now. If there will be any next pandemic, we know some country are already prepared.
Yes.
But we find ourselves in a continent whereby until the rains comes, nobody will come with umbrella. So it's a major challenge when it comes to the financing. And thank God we have certain organizations that have been helping Africa. And we have Bill Gates Foundation. We have recently, I think China just stood up to our fight when it comes to Ebola. Ebola is actually ravaging some part of Africa currently. We have Uganda and that problem now. And we have, I think we have majorly Uganda in that problem now. And I think there's a case now in France. Yeah, the funders are trying their best, but the problem of Africa still remains the problem of Africa. No matter how the funding, it will come to people's hand. Yeah, you get what I'm saying?
Yes,
So
absolutely.
it's not about the money alone. It's about the people involved.
Yes.
It's about the people involved. I always say it that Africans cannot totally depend on the Western world. Western world have their own problems too. As much as they are trying to face their problem, they are trying to help us too. So the fund is not enough. I just think we African, as much as they are trying to help us, we should stand up to our own fight too. So the second question, I don't know if I get it so right, is about local people involving in what?
Sort of like the knowledge of the local people, the local communities, because I feel that if you are from a region, you know best how the communities in your region work. So, how can we best utilize that when it comes to evidence-based research?
Oh, thank you. Thank you very much. Yeah, let me tell you one fact here today. An average African child run from fasting. So we have to, I think, if fasting will be effective in Africa, it's not just having the product of a fasting, we need to equip Africa with knowledge. You will be shocked that some people believe that if they take a vaccine, they might be prone to some illness. So it's not just about what they know. We have to let them know the right thing. So if you come to Africa now, you are coming with a whole lot of vaccines that can be enough for everybody. I'm telling you, some people will be saying you and they will not come to you because they have a knowledge that is not right about vaccine. So the way to deal with this, just as I said, is just implementation science. Get to know what their issue is. And one of the aspects when it comes to implementation science in Africa is that you have to gain their trust. So by the time we are going to the field, we have to carry their religious leader along. Because an African believes their religious leader than the scientists. So once you're able to make their religious leaders accept what you are bringing to them, that it cannot harm them, is to protect them, you will find out that you will easily access them. But what I'm just saying is not just a matter of 1 month, 2 months. You might be doing this field trip, going to them, loving them, having known what they like for the next 3 months. It's a whole lot. So in the next few months, I and my team will be going on to a village, a rural community. So part of our implementation science want to practice there that for 4 months we'll be going there every week to let them know human papilloma virus, is a preventable can cause a preventable cancer if you take this vaccine. So there is a problem for there's a solution for the problem it can cause. But it's not just a matter of saying it one time and they will accept. So that is it. The first thing to do is let them know the right thing.
Yes.
Let them know the right thing. The northern part of Nigeria, we have poverty at a very high rate and illiteracy. So WHO have been focusing on that part. UNICEF have been focusing on that, putting so much money, but the solution is not just coming with the vaccine. Train them for a longer time. They will take the vaccine in just a day.
Absolutely. So, we place a lot of hope on younger people, the upcoming generations,
Yeah,
the future generations.
yeah.
What role do you think young people play in shaping the future of global health? And how can they be meaningfully involved in research and innovation processes?
Yeah, thank you very much. Yeah, young people play an important role in shaping global health. They can bring creativities, technology competence, community knowledge, life experience, energy, and new perspective. In my part of the world, in Africa, yeah, we believe that the younger ones have more energy, have more creative ability than the older ones. So if you see a nation thriving, it's because the younger ones there. That is a major point when it comes to this, and they can participate as researcher, co-investigators, innovators, entrepreneurs, data scientists, community mobilizers, science communicators, policy advocates, and decision makers. So, however, meaningful youth involvement must go beyond inviting people to conferences, using them for publicity and asking them to implement decisions made by others. So young people should be involved in identifying research priorities, designing research questions, collecting and analyzing data, developing health technologies, interpreting findings, and actually evaluating programs and participating in policy decision. So that is that. So, and this meaningful participation requires access to mentorship, funding, infrastructure, authorship, leadership opportunities. Where I just went to just return back was actually a trip paid by NIH over there. So they find interesting young people like me that have interest in the field, and they feel like, okay, let's bring these people on board. So that is one of those things I think the Western. I've never paid for a flight going for conference. So the Western would believe that I'm from low middle income country. Let's bring these guys on for us to be part of this decision. So that's the platform of mentorship. So institutions must ensure that young women, rural youth, people with disabilities. It's unfortunate to say this, African wars don't have plan for people with disabilities. If you go to our hospitals, they have to use the same route. If you go to our bus park, they have to use the same route. If you go to our banks, they have to use the same route, which is not so okay. So, and young people from disadvantaged background are not included too. So young people should not be treated only as the future leader. They are present researchers, innovators, advocates, and partners in global health. Thank you.
So, what you discussed, I have a relevant question in relation to that. Many health challenges, especially in the developing world, in low and middle income countries, are interconnected with issues such as poverty, education, gender equality, climate change, and also sort of like it takes money to build an infrastructure that supports people with disability. How does your work
Yeah.
address the intersections to support sustainable development? Like, what is the way forward?
Yeah, health challenges rarely exist independently of social, economic, and environmental conditions. So, poverty can prevent people from paying for transport, diagnostics, treatment, and preventive services. And also, limited education can affect health illiteracy and ability to recognize reliable health information. So, gender inequality rather can restrict access to health service and decision making. Climate change can affect disease transmission, food insecurity, water availability, migration, and health infrastructure. This is where my work comes in. My work addresses this intersection through One Health research. antimicrobial resistance, infectious disease preparedness, environmental surveillance, climate-related microbiology. Some of these pathogens that we're having issue with now is actually caused by climate change. They have been in existence before, not so active. Suddenly they come up, spring up, and started causing issue. So we cannot leave pandemic without talking about climate change. Affordability and public health preparedness. That's how my work comes. My work in vaccine design supports infectious disease prevention. My work in antimicrobial resistance addresses a major threat affecting human, animal, and environmental health. So my role also, my mentorship role in training young people support educations, young development, and scientific capacity. And sustainable development therefore required us to consider both this disease, the wider conditions that make people vulnerable to disease.
And what are some of the biggest barriers to conducting and implementing evidence-based health research, particularly in low resource settings and, in regions where you come from, Africa, and how can they be overcome?
One major barrier is inadequate or short-term research funding. Research priorities may be defined externally without sufficient attention to local needs. So another barrier is limited laboratories and digital infrastructures, institutions lack equipment, schools unstable electricities, internet connectivities, reagents, secure data system, technical maintenance support. There are also challenges related to fragmented data, weakened surveillance system, insufficient mentorship, limited specialist training, weak connections between researchers and policymakers. I believe all scientific findings should lead to a policy. So community trust can be affected when the researchers collect data without providing feedback, communicating the benefit of the research. So some international collaborations may be unequal. Local researchers may contribute samples, field access, contextual knowledge, while having limited influence over funding, authorship, data ownership, or research priorities. So this barrier can be overcome through increased domestic research investment, just as I've mentioned before, long-term institutional partnership, shared infrastructure, stronger mentorship, transparent data governances, local technology development where we need youth to come in, equitable authorship, and fair benefit sharing. And community and policy makers should be involved in the beginning of the research process. So South to South collaboration, have been a benefit of this. South to South collaboration should also be strengthened so that African countries facing similar challenges can share knowledge, infrastructures, and local relevant solution. Yeah.
Thank you so much. So before I ask you the next question, I just want to encourage everyone who joined us to put their questions in the chat box if they want to ask you any questions, because I will be looking at those questions right after my next question. So if anyone has any question for Oluwase, please post your questions in our chat box. So my next question for you is, looking ahead, what emerging trends in health research, innovation, or youth leadership give you the most hope for accelerating progress towards the Sustainable Development Goals?
Several emerging trends eventually give me hope, and artificial intelligence and genomics, accelerated biological analysis, the surveillance, early stage vaccine and research, vaccine and drug research, and also precision public health is helping researchers use data to identify population as risk and design more targeted intervention. So portable diagnostic and decentralized testing are bringing health services closer to the community. And wastewater and environmental surveillance are strengthening early warning system for infectious disease. In the northern part of Nigeria, every year we have outbreak of cholera, losing certain number of people to this. So with now that we now have a surveillance system that can tell us, okay, these things have the potential of coming to you, people. So that is very important. Implementation science is helping researchers understand how effective intervention should be um, adapted and sustained in a real health system in Africa. Open science in the improving access to data, research methods, commissioner tools, and training resources. And local biotechnology development is creating opportunities for African countries to develop and manufacture health technology rather than only remaining as a consumer. So, Youth-led research network, I belong to a quite number of them, and I'm so glad to join these too. And social innovations also give us hope. You people like this having such a program where youths can come around, we can share our opinion, is a lot. It's actually telling us there is a light at the end of the tunnel. So young people are developing digital solutions, forming collaborations, leading advocacy just like this, advocacy the initiative, and establishing biotechnology enterprise. So the convergence of science, responsible technology, community knowledge, local ownership, and youth leadership offer a strong opportunity to accelerate progress towards the SDGs. Yeah.
Absolutely. So I'm going to go ahead and ask you my last question, but before I do that, I'll just check if anyone has any question for you. And also, I'll just put it out there that we exist in most of the social media platforms. We're in Facebook, on Instagram, on YouTube, Spotify, on X, where we all promote our speakers like yourself and change makers that we spotlight. So, we have a micro grant program where we provide nominal grants to help people sort of ease their work, as well as we publish blogs. So if changemakers wanted to write about an issue or their work, we publish it for them. There are a lot of things that we're trying to do. It will be great if everyone who joined us today could spread the word, nominate people so that we can spotlight their work, just like yourself always say. So please do encourage, please do spread the word, our network within your networks. And also I'll leave you with a open invitation. Your field is so specific. We work with, we're focusing on Agenda 2030 Sustainable Development Goals. If we could contribute in advancing your work, it could be through a collaboration, it could be through advocacy, you're more than welcome to come to us and discuss ideas. So that's what I just wanted to. And we have a huge network base of change makers who are very knowledgeable when it comes to their own issues. So if you thought that you needed information, you needed evidence on particular communities, and I'm very honored to say that probably we have the highest number of change makers from Nigeria. We are very heavily represented from that region. So that's there for you. Now I'm going to move on to the questions that we received from our audience today. So we have one question from Gertrude. Gertrude is one of the co-founders. Originally, she's from Ghana. Gertrude asked you, what has been the most memorable and challenging project you have worked on so far, and any lessons from that?
Yeah. Yeah, thank you very much. I'm so glad she's from Ghana. Yeah, glad to see. Yeah, glad to hear from Nigeria and Ghana. People think we are next door neighbors, but we have about 2-3 countries between us, but we are very, very close. We banter each other a lot. As they are playing the World Cup, we Nigerians were waiting for Ghana to lose so that we can laugh at them because we didn't qualify. So I'm so glad she's from Ghana. Thank you. Good to have you, my sister. Yeah. The most memorable, challenging project I've worked on is on pathogens that are of African origin. Just I have mentioned. Where I've worked on certain number of them. We have Babanki virus from Cameroon. And the challenge is that we have limited genomics and epidemiological data. There is no so much, data in Africa is a big problem. So the project was challenging because working on under-researched pathogens meant the available sequences data are limited. And every stage required careful validation. So we have to analyze viral proteins, identify the immunogenic region, construct the vaccine, evaluate the predicted safety and immune response. There was a time I did a work on a particular pathogen. I left it. I think I submitted it. After 3 months, they called me back that the vaccine is not stable. So I have to go back to the construction stage. And that is that. And when it comes to bioinformatics approach in Africa, bioinformatics, you cannot do bioinformatics without good internet and electricity.
Mm.
Yeah, you cannot do bioinformatics. Your laptops have to be on. Your internet challenge. So the first lesson I learned there is actually scientific patience. Scientific patience. So we just have to follow a very rigorous path. In Africa, where those things are not so stable, you are not sure there'll be light. It's not all of Africa that have stable 247 electricity. So I have to follow a very really path and see some unexpected results, require repeated analysis and critical reflections. So the second lesson was actually value of collaboration. At a point, I had to collaborate with people from the United Kingdom. I have a collaborator at the University of Birmingham to see how we can go through this thing. And the third one is that the third lesson I learned from this is that the importance of communicating limitation honestly. If there's a limitation, communicate it. Although scientific studies identify promising vaccine candidates, computational findings are only an early stage, so must be followed up by laboratories and clinical validation. So we just do our work on laptop, get the candidates, and do stuff like that. And finally, the project taught me that limited resources should not prevent innovation. We cannot wait until we have all what we need. We have to start with what we have. With strong mentorship, collaboration, open scientific tools, and a clearly defined problem, young researchers can generate valuable evidence, contribute to solution for neglected health challenges. Thank you very much for that question.
Thank you, Oluwase. We received another comment and a question from one of our audience members. Her name is Hannah Ajifa Ibrahim. Hannah said, "Thank you, Global Activist Network, for organizing this. Thank you to the amazing speaker, Mr. Samuel Oluwase Akinpelu." Hannah's question is, how can a recent graduate go into research for another field in Africa, for example, food safety?
Yeah, thank you very much, and Hannah, thank you for a wonderful question. One thing I will always say to you is that start something. For you to be a young, promising African scientist, and you being from low middle income country like me, you have an advantage. There's a lot of funding there for you. So the Western world is making it so possible for us that we are from low middle income country like that. If you have a project, reach out to certain. You have organization you can reach out to. They are there on all social media. You will see call for this, call for that. So if you want to go into food safety, we have agencies that are into that. If we have agencies that are ready to finance stuff that is relatable to Africa, reach out to them. Go for conferences. Um, Go for conferences, attend seminars, get yourself equipped with knowledge of what is trending out in that field. Food safety now, we are not talking about mycotoxin, GMOs, because you must be doing what is relevant for them to check out for you. So don't limit yourself. Conferences are there. There's a conference holding up in Nigeria currently on green microbiology. I was supposed to be there, but my flight, I came back to this country around to this state rather around 8 a.m. So I just have to rest. So that is that. Keep doing your best. Be all out there. Go on internet. Join organization. So join some certain organization because we are from low middle countries. It's even free. Yeah, so that is that. That is equity. Yeah.
Absolutely, absolutely. We have another question from Taiwo. Taiwo is one of our team members at the Global Activist Network, and also he's from Nigeria. So he
Oh, Mr. Taiwo.
said, well done, Oluwase. Taiwo asked, do you have a mentor? If yes, how has that shaped your becoming?
Yeah, I have a mentor. So I met my mentor in the year 2023, April precisely. And, you know, I come from a background whereby if you eventually talk about traveling out, going for conferences, it's always like a mirage. So that is one first thing. So my mentor shaped me to be like this and let me know that I'm a global candidate if I don't stop. So that is the first thing. So this mentor really shaped my mind that I have something to offer. So that is that. So and eventually he led me to start working on some things. The first fasting project I did it with him. you know, taking me along through this project took them longer time, but um, that is one of the things when it comes to mentorship. If it is with him and the people that have already been an expert in that field, they will have done all these things within around 4 months. Dragging me along, it took them 9 months. Yeah, so you could see that is one of that thing I've shaped my becoming. And in the next a few months, a few days now, I'll be flying to Addis Ababa to present my work at Institute of Tropical Medicine Conference. So it's one of those things, the mentors just feel like you can do this thing, put in your abstract for this thing, try this thing out, you can be there. When I met my mentor, I don't even have an international passport. So you just feel like, okay, take an international passport, apply for this, you will be given funding to come. So it's still shaping me till now.
A right mentor can really make you and show you the path. That's so important. We have a second question for you from Gertrude. Gertrude asked you, what is your stance on awards or recognition when it comes to social impact work? Does it matter to you or the work that you do?
Yeah, both. Let me say both. I will talk about the work first, not talking about the award. The award should come after you have worked. Yeah, so the work first, even though it actually received little recognition, and I believe social impact work is the one that is influencing our community to the rural level. The work first, one thing is that you must bear the pain of your people in your heart beyond the award. You must bear the pain. When you grow up in a society where there is no good water, a youth should be like, how can we resolve this issue? So the work first, I believe the work affects a lot of people than your award. The award can come, the award might not come, but people you have impact on, you have the mark forever. So they are your award. If there is no award, they are truly your award. Seeing children talking about, oh, this guy brought this thing to our town, we have this issue, this thing is now solved, is beyond an award. You make lives. HPV now killing a lot of people. Somebody just come, implementation science, and the girls get fascinated. Building a girl is actually building a nation. It's a social impact. The award might not come, but you save a girl, you save a future, you save a lot of people. So that is that. The work is more important than the award. That's it. So but when people get the award, it encourages other people to go into it.
Thank you for your wise words, Oluwase. My last question for you. Do you have any last words or suggestions for us? And if anyone wanted to get in touch with you, how do we reach you?
Okay, thank you very much. My first recommendation is that government and institutions should invest in locally relevant evidence-based research. It is so unfortunately that sometimes what we get from the Western world might not work here
Hmm.
because they're actually tailored towards you people there. Do you know an iPhone here? If you buy an iPhone in Nigeria, sometimes you have to have a power bank, or you have to be going around with your charger, your phone charger, because why they were still designing the iPhone, they didn't consider the African region where they know that you can have the phone. If there's no electricity, you cannot even use the phone.
Hmm.
So I just believe if there is investment in locally relevant evidence-based research, it will help. The second recommendation is that as innovation should be designed for equity, if not for equity's sake. Possibly you might not bring on an African. But thank you very much for providing this platform and giving voices to young from Ghana. Thank you very much. I was in Alisa Hotel in Accra in April. Yeah, so it should be designed for equity. It should be affordable, accessible. Not all your things you send over there, before they get to our people, they should be translated to our languages. You know, we speak English in our official language, but we still have people in our area that cannot read or write English. So
Hmm.
the language, disability inclusion, people that have disabilities, how would they be carried along to? Digital literacy, privacy, and sustainable should be considered from the beginning. So not just giving us the solution and fit and think it will fit in for us. So the tech recommendation is that communities should rather be treated as partners rather than research participants. Get them involved from the beginning, let them know the findings. We have that problem. People come into Africa, get the data. When the solution is out, they didn't let them know again. So that is so they lose trust. They lose trust in some of these interventions. The fourth one is that young people should also receive funding, mentorship, interventions, leadership responsibilities, and genuine decision making power. If not for me coming through a mentor who virtually find, hey, I'll be out there saying I'm looking for a job too. Africa is another job. We have people dying. We have people undergoing a lot of issues. If our young people are empowered, they already have something to do on ground. So the fifth one, which will be the second to the last, is that international partnerships should be strengthened with local capacities. Technology transfer, that is so important, institutional development, and long-term sustainability. And my final message is that evidence without implementation is knowledge unused.
Hmm.
Innovation without equities can widen existing inequities. Young participation without influence is tokens. And the future of global health will be built through rigorous science, responsible innovation, community participation, equitable partnership, meaningful youth leadership. So that is my final word. So people can reach me via this following platform. My email address, I will drop it in the chat box now. Akepelu
And
Oluwaseyi
if
98.
anyone reaches out, we can always provide your email address with them if they want
Yeah,
to
yeah,
get in touch with you. That's all always be there. So
exactly. So I'm
yeah.
I'm active on LinkedIn, Oluwaseyi Samuel Akepelu, and people can go into my profile, check my Google Scholar, ResearchGate, see what I'm doing, what I've done. So thank you. Thank you. Thank you for the opportunity to share my thoughts. I look forward to connecting, collaborating, and contributing to evidence-based solutions for sustainable global health. So thank you for having me.
Well, thank you so much for joining us, Ulwase, on a weekend. And, we have joined from very different time zones. Thank you for making your time. And, this is the first time we have discussed about something that's so niche, that's so progressive in the health research arena. So we're really privileged to have this discussion. And we hope to invite you back at some point because, it's never enough to discuss these things within a 60-minute period. So I'm sure that people would want to learn more. and I'm confident
Yeah.
that you'll come back with more accomplishments. So, looking forward to that, and good luck to you. And let's spread the word. Nominate someone if you see someone doing amazing work. Please nominate for the
Yeah,
Global
definitely.
Actors Network. And yeah, have a nice day, everyone. Thank you for joining us.